that we're in, which is quite tight, and what impact that's having for your own services. For example, with the council having had Section 114 notices, there's a sense amongst the community when we speak to people that actually, you know, there isn't any money at the council, so it's no point asking them for anything. How is that impacting on adult social care, would you say?
Well, obviously, the council's been in the news a lot around the finances. First of all, I'd like to say we're not in 114 anymore, so we've actually, we're out of 114.
So could you bring up the
So what does that mean?
114.
114 is a statutory, it's around the finances, so it's actually, we have a section 115 officer. They're all numbers, aren't they? So we have.
This is from an act.
Yeah, it's an act. So it's finance. We have a finance group, and it's how whether we are financially viable in the council, and whether we can meet our statutory, we can pay our bills, and we can also set budgets for the following year. And at different times, we haven't been able to do that in Croydon. At the moment, we have been able. We're not in. The person who manages the finances, who's the statutory officer for the finance, it's her decision whether she has to say whether we go into 114, because she's the accountant, so she manages the money. But at the moment, our money in the council, we're managing it. It is tight. It's tight. It's not just Croydon. It's tight across everywhere in the country. So what does that mean for adult social care? Well, adult social care, I have to say, is the biggest spender in the council. So there is a big focus on adult social care. And at the moment, in adult social care in Croydon, we're able to meet people's needs within, but we have to watch everything we're spending. So we are being very careful with the money that we're spending within the council. And I have to ensure that we we manage the money rigorously in the council. So, and we have got a duty to provide good quality services here in Croydon and manage the markets and manage the providers that are providing the care. So we're managing to do that. But quite often we talk about the Croydon pound, so it's not just adult social care. We need to work with our health colleagues and our voluntary sector and making sure every penny that we spend in Croydon, that I can get the maximum out of that every pound we're spending here, enable to meet the needs of individuals, whether it's social care, whether we can join and prevention, whether we can do things and preventing the care. So at the moment it's tough, but we are meeting people's needs and we are doing assessment. The council is open for business. We are working on prevention and last week, just so people know, that we've had an outside agency that's coming to look at social care. So we've had we're going into assurance, so an inspection with CPC, and we've had the LGA, which is the local government association, that's come in and done an inspection with us. And some of you may have been involved in that last week, because there have been lots of people in and out of the council, and they've listened to people's views. And what they're saying is that we're doing okay here in Croydon at the moment in adult social care. Lots of room for improvement, always is, but we're doing okay here in Croydon.
Do you mind? Yeah. You've been waiting a long time to speak. Was it about this in particular?
Yeah, thank you. I can take my just with regard to these, you said that we're not, at the moment, we're not in that, under that anymore. I just wondered perhaps if that's something that could change, because I read only, I think, last week that we might be heading towards that again, I think for the full time. And I don't know if, for Croydon, I don't know if that's the case. Is it possible that somehow that could change in the coming months? So I read, last week that it is likely that Croydon could be heading towards the section 1.
We're in we have all councils could, like it's not just Croydon. I think because we read in the newspapers and in the news that there is a lot. The councillors and the members and our finance, they are really managing the finance well in Croydon. We will need support. There will be need support. We will have to manage the finances rigorously. We will, so I wouldn't like to say no, we wouldn't, but it's not anticipated at the moment that we will. We're going to government, we're requesting support from government, looking at the finances is one of the high priorities of the council at the moment.
Thank you.
And this gentleman.
Yeah, it's about the budget really. There's a speculated budget for 2024-25. Is there a reduction in the adult social care budget?
Yes, there will be, but it will be, so there will be MTFS, which is the medium term, so there's savings. There will always be savings where if you work within any department in the council, you'll always be looking at ways that you can save. But change and move on and how you do things differently, you've always got to look at where there's savings within the budget. And in adult social care, we're no different from any other department. We are we are one of the departments that spends actually the most in the council, and there will be requirements of me to bring savings in. But that is not, I will always be looking at growth and the demand that's coming into the services. So we look at our demand that comes into adult social care. We know young people will age and there will always be a demand. So in setting the budget, we need to make sure that we've really got rigor and we're careful in setting that budget, that we can meet our statutory duty. We take into account our demand and inflation. So, paying our providers and making sure we get good quality care. We need to make sure we, put that into the budget, that we have our inflation and that we can pay set the right budget for adult social care. And that's done collectively. It's not just that being done within children within the bigger council restraints.
Thanks. Could I ask Matthew how it is for the NHS?
Yeah, so to give Annette a break as much as anything. But what Annette is experiencing from the social care and the wider council is also true in other public services, NHS being one. So our budgets this year, we had to make savings. Our budget is about £400 million, and we've had to make savings of about £30 million this year, and that will be a similar sort of figure next year as well. And that is not particularly different to any other part of the NHS. So if you go to Epsom St Helier or to St George's or into South East London, it's a similar sort of figure. And that obviously does make it challenging. It would be stupid to say that it doesn't. But what we've been trying to do, again like the council, is look at how we can be more efficient and effective about how we use our money, and that's important because it's taxpayers' money at the end of the day. So we've looked at things like how can we reduce our temporary staffing costs and increase the number of people we employ on a full-time basis, because that's better from the staff's perspective and is a better way of us using the money. And we've done that actually very successfully over the last 6 months. So that's an area where we've targeted and we've made some improvements. Same thing is how we can more sort of efficiently, from a financial point of view, utilise the capacity we've got, by which I mean how do we make sure we fully use all the space we've got in theatres, and then we make sure we don't cancel too many outpatient appointments and have patients not coming and then have free slots. So we've been looking at how we can improve the booking of outpatients, how we can improve how many patients we book into theatre lists. And we've got the new elective centre at Croydon, which we can plan the activity much better, so that's helped us do that. So we're looking to actually increase the amount of activity we do. We've had the strikes, unfortunately, this year, which look like they might be coming to an end, so that will help us over the next few months really push on and treat more patients, which is better from a patient's perspective, but also it will help us make sure that we can generate the money to manage our books a little bit easier, hopefully. So it's that sort of thing that we're doing. We're also looking at things like the non-clinical services. So how do we use our estates and facilities teams? How do we look at HR, so the personnel side of our work, and the financial management, and how do we make those as efficient as we can as well? Because all the time what we're trying to do is maintain our financial position whilst also not adversely affecting the quality of care or the access that we can offer to patients. And that balance between those three things is difficult, it's always difficult, but it is our job to do that. And at the moment, what we said we'd do this year, we're on track to deliver, but we're going to have to redouble our efforts because we're going to have to do a similar sort of thing next year, and obviously doing it year after year makes it a little bit harder each time. So unfortunately, that's where we are at the moment. We'll wait and see what the budgets will give us as we get into the new financial year.
Okay, thanks very much, thank you. Sarah, so what impact is all of this having on the voluntary sector, would you say? And
Thanks, Edwina. I mean, we have a very diverse sector in Croydon. I think many people would resonate that actually we're very strong in communities. The people and the champions amongst, out there are incredible. The loss of the community fund was devastating. I think we're still at risk for quite a number of our charities, groups and community groups, some of which were, to use an example of the Samaritans popping in New Addington, serving 70 to 100 elders each week who have testified if they don't have somewhere to go for respite in a week, then the family will need to send them to residential care. So in terms of cost saving, these kind of groups operate on very small amounts of money, are absolutely keeping the problem away from the services that are so much more costly. I think in terms of where we're at, I mean, out of crisis always comes the creativity and the strength of communities, and we saw that in abundance during COVID, didn't we? Where, our services, we want our services to be strong for when we need them, and we need even more our communities there to keep us well and to keep us safe. And I think we saw that in abundance. I think Croydon in particular rose to that, and we saw some incredible demonstrations of selflessness, going above and beyond. I think we still rely on that, and it's something that I keep saying, that from the food bank network, our 50 groups that are out in communities serving people in food poverty, they are seeing highest numbers now, higher than in the pandemic. We have the lowest amount of donations. So, we need to collectively not only work together to work in crisis, but more than anything, I think we need to have a vision about beyond this for Croydon. We need to be thinking about how we each play our parts as organisations, but as also to enable the strength of our people to be part of this solution and to vision a better place for Croydon. I think there's a massive ambition from that. I think there's an ambition across the panel. I think it's in the room. But we need to enable it, and we need to allow and build the strength of communities, allow it to happen, and invest in prevention.
thank you, thanks. And if I could turn to Alyssa. Alyssa's been in a new post for getting on for a year. Yeah. As you heard earlier, working with the integrated care system, get it right, across southwest London on behalf of the local Healthwatch. In the short time that you've been in this new role, do you think the ICS is actually making any sort of difference to the challenges that people are having, that organisations are having?
I certainly think it's doing a good job of helping us work across the voluntary sector, across NHS, across social care, and in partnership. We had just a few weeks ago a fund that was available that really encouraged collaboration across sectors to meet people's needs across a wide variety of priorities. That included things like children and young people's mental health, aging well, and ensuring that we're always addressing health inequalities. I think another thing that's been working really well is that there have been avenues for us to raise your concerns For example, when they were drawing up their 5-year plans, the integrated care system, they asked all of the Healthwatch for their reports over the last 5 years. And we were able to send 100 reports, and we were also able to take part in the actual drafting of those documents. So we saw the drafts, we made comments, we asked, okay, we see that you've listed people's concerns, but how are you going to address that? So we really appreciated those opportunities to actually make sure that you're being listened to. And then as in terms of next steps, we're now seeing that there's delivery groups being created. So now that we have the priorities listed, how are we actually going to put those to address those? So I'm not sure how that's going to work out, but I am optimistic. We're just putting that into place now. And in terms of actually being able to say, are we making a difference? Part of that, part of the implementation of these new delivery groups is thinking about how we're going to actually measure our impact. So we'll be able to say a little bit more than anecdotally whether or not we're making a difference.
Yeah, thanks, thank you. We started this panel a bit late today because of everything else we've been trying to do, so we're kind of running out of time, but I've just got one last question. But if I ask it of the panel, maybe we should all decide who's going to answer. So it's how are you working together to ensure good access and outcomes for Croydon's residents in terms of health and social care?
Well, should I start? And then Annette will correct me when I get it wrong or add to it. I think in Croydon, and I've worked in lots of places across London and the South East, the relationships and the connection between the various agencies might not feel it always, but are closer and more productive than in most places I've worked. So I think that's the first thing to say. But that doesn't, just because that's been the case, you've got to keep going at that all the time because it is something that can be lost quite easily and quite quickly, and that's particularly true at a time when the money's tight, the pressure's high, there's lots of other priorities going on, and in those circumstances people can go back a little bit into their own places and forget about the partnership working. And actually I think, so reference COVID, the financial challenge, the pressures around the activity and the demand, the winter that we're in. Actually, in all of those examples, my experience though is that people have actually stepped forward a little bit, not stepped back, and that the partnership is a real strong thing here in Croydon. It's not just a set of words that we use, it's something that it feels like it working in the system. There is a strong partnership approach. And we're doing lots of individual pieces of work that demonstrate it. So Annette and I are both involved in something called Front Runner, which is a national programme looking at how patients get discharged from hospital, how we can improve that flow of patients. And that is a massively important piece for the patients themselves, but it's also really important for both health and social care. So we make that piece work better, then that's going to help the system. It's going to help individual organisations, and most importantly, it's going to help patients, we think, get a better service. Those sort of initiatives only work if the partnership is a real thing that is actively working. It's not to say we don't disagree with that stuff. There are plenty of things that Annette and I and our colleagues wouldn't always agree with each other about, but that is about a real partnership because it's about through how you can overcome that and come to a position which actually we can then move forward and work together. That is the reality of life, rather than us all just saying all the time, yes, we completely agree on everything. Because if you do that, you're probably not actually having a proper set of conversations about difficult things we need to change. So that's what I'd say. But
well, I think there is. I think when we went into the south, or part of South West London, and it becomes a reality that Croydon's actually got a really good partnership when you go to work in a bigger environment, because you can see that they were starting from a quite low level, whereas Croydon is starting from a phase of partnership. And the partnership has two organisations, the Council on Health, are two great organisations, they call them anchor institutions, but actually the partnership is much wider than just health and social care. It is a voluntary sector, and I agree. There's been huge problem. There's been reductions. In funding, because of the situation that Croydon's in, but that, as you say, things happen. We reset the relationship. So you can fall out with partners at different times, but it's actually, if you've got a good partnership, it's about being able to have those conversations, make those changes, and how we can develop going forward. So I think we realise in Croydon that we started from a very good place in this big situation we're in now at South West London or across London, and how we build upon that. And it's not just social care and the health. The partnership's wider than that. You know, it's very much, you know, we talk about patients' voice or the residents' voice or the carers' voice, and, you know, and we get that through the voluntary sector. We have our mental health systems that are involved in it. So the partnership's bigger than just adult social care, and it's our market. So we have a big market here in Croydon. We employ a lot of people through our market, and it's working with those markets to make sure that the partnership works together.
Okay, thank you.
Would you mind? Yeah, I know I've got to keep it tight, but I do want to mention the Healthy Communities Together work and the partnership. So we're meeting in partnerships locally in the 6 localities of Croydon. You're all very warmly welcome. But it's about joining up and looking at key priorities as identified by local people. So in our southeast, for instance, they've identified health access. And it's not about moaning about the problem, it's about how can we all work together to constructively, you know, hear the problem and then resolve the problem, because people and communities have got an important role to play in translating in the different forms of communication. So there's also our community hubs. We've got a real ambition through that body of work to have places open for people, places where people can go and get support. But also go and recognise their own skills and find that they have things that can help others. And those are some of the brilliant change stories that we've captured. People come along, you know, thinking that they've come along to then anger or to try and get some particular service, and actually have ended up being a real agent of help giving and creating shared space for peer support and healing. So again, there's this wide ambition amongst us for this join up, and when people then do need services, we need to know. If somebody comes in confused to a community hub and we know that there's an issue there, we need to be able to check out that social work knows about it, that the GP isn't, you know, has this information and is able to properly support on a clinical basis. So it really is about joining up that whole piece of work, and I think we've built some really strong foundations in the borough on that. And if you haven't yet been to either a local community partnership or a community hub, please do. I'm not saying that they're end products, it's all a journey. These are strong foundations that we're working towards, but you know, I think it's a really powerful piece of work and speaks to proper democracy, which again, you know, great to have that, because I think sometimes in crisis we're able to find different ways through and start with the strength, and for me the strength is in our people.
Yeah, I think that's a good place to end. The lady over there says she wants to say something. Can you be very, very brief?
Yes, very, very brief.
Out of time.
This question is for my head of social care. I work with aging care, and right across the community we have an issue. Could you just explain what the procedure is for service providers who are providing care post-discharge, going home under the reablement teams who are providing services post-discharge and then moving on to dom care packages? Who is actually in control of ameliorating and making sure that those services, when the service providers fail to provide the service that they should be providing to those service users, why are they still on the list of social services commissioned database?
All right. So if you've got individuals that you're talking about, I'll talk to you outside bars.
Yeah.
So all of the providers that we use are CQC registered providers. So they're not, they're inspected. They're independent providers that are CQC We actually monitor the providers, so there will always be individuals that it doesn't work for. I tell you that, there always will, but Croydon do not buy any services from anyone that is not good or outstanding. So and we have provider concerns, so we do safeguarding and provider concerns. We monitor that really rigorously through our brokerage system in Croydon. So we do not purchase any services from any agencies that are not CQC registered and that are not rated good or outstanding. So if it's on individual cases, then I will talk to you about that. But how it steps down, and we have a dynamic, I could go in dynamic purchasing.
Completely understand.
So there's processes that we have to follow through.
Yes.
And we only purchase, we don't just go and buy from anybody, we buy from a list of providers that we are, and we keep the business local.
Yeah.
So we try to keep the business where we keep people that are working in Croydon for the workers in Croydon. So we try to keep local business local.
I hope that's okay. Yeah, I can talk afterwards.
Yes.
That's great. Thank you. Well, thank you ever so much to everybody for coming. And I'm sorry that we've run out of time. I'm sure there are lots of questions. People are just getting warmed up and there are lots of things they'd like to ask. But unfortunately, people have got other meetings to get onto, so I'm sorry about that. However, I'm really pleased to say that our Executive Mayor, Mayor Perry, has been able to join us for the last part of the meeting. And so he's been able to hear about your concerns as well, and I'm sure he'll be speaking to the officers afterwards as appropriate. I don't know if you've got any reflections, Mayor Perry, that you'd like to share with us at all, just as we're closing the meeting?
Can I come that way?
It's entirely up to you.
Save everyone turning round.
Yes, okay. Move out to the way, there we are.
Thank you. Thanks very much. Thanks, Edwina, and thank you, Gordon and team, and everyone at the Healthwatch and what you're doing to support health and residents in Croydon. I think it's probably worth just touching on the financial piece, as obviously that was the main thrust of the conversation, and around Section 114. So Section 114 is essentially says that the council is unable to provide a balanced budget. So, and councils have to, by law, have a balanced budget. Matthew's in a slightly different position. He's allowed to have an unbalanced budget. But local authorities, he has to have a plan to get out of it, but local authorities, we're not allowed to not have a balanced budget. And when we're in that position, that's when our Chief Finance Officer will say we're in Section 114 territory, which means we need assistance to balance our budget. That could be asset sales, it could be many different things. So what's happened in Croydon is we've been given something by the government called capitalisation directives, which means that essentially we are allowed to borrow money in order to balance our budget. But that's not a long-term fix for the problems that we have as a borough. And we kind of moved into spend, and as Annette rightly says, 30p in the pound is spent on adult social care in Croydon, 20p in the pound spent on children's in Croydon. So a lot of our money is spent on those two key areas. But we're also spending nearly 20p in the pound servicing debt as a council. So we've got a big debt problem of 1.6 billion, and we're spending a lot of money servicing that. And that's the really big conversation with government about how we deal with that particular debt burden that we carry, so that we can spend more money on local services. I think just kind of coming on to how are we then coping with that, and I think it's about, there are reductions in budget, but there's also growth in budget. So we might be reducing in some areas but growing in other areas. And Annette is a bit of a whiz at making things work differently in adults particularly, and she's a great defender of adults and making sure that while she's very robust with her budgets and making sure that we meet our budget, she's also looking at innovation and how we can do things differently. And that's where that partnership working comes into place, and working across our statutory partners to do things differently, working with the voluntary sector, all the things that we discussed at the front of the room. South West London Partnership, we know 50% of the need is in Croydon across South West London Partnership, but at the moment 50% of the spend is not in Croydon. So there's a little bit of a challenge for South West London Partnership about how we get that spend kind of where the need is across the partnership. So there's lots of different things happening on that score. I guess coming on to Healthwatch, again, it's that partnership piece, that integration, the One Croydon Alliance, the local partnerships, the 6 partnerships, are all so important in delivering better outcomes for residents in Croydon at the end of the day. I think I'm being told time's up, so that's about delivering those outcomes. Since becoming mayor, I now jointly chair the Health and Care Board, which I think is a really important thing, bringing council and health even closer together. You'll be pleased to know Gordon sits on that board and asks lots of questions, so he's there challenging every board meeting, which is a good thing, and that's obviously the whole point. And really just a thank you for the work that you are doing as a body, just flicking, a fantastic annual report, looking at the work you've done on dementia as an example, feeding into the dementia strategy. We now have the dementia strategy. We're now a dementia-friendly borough, again, something that we lost but we've regained. So you have been part of getting us back to that position. So it's that true partnership working, and just a big thank you to all of you, Edwina, Gordon, the team, for the work you're doing, and all of you in the room for the input that you put into the system, and long may it continue. Thank you very much indeed.